Hello friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today, let's move on to part 3 of anatomy. In this episode, I'll be explaining few CPC practice questions which had already come in the previous examination papers. So let's move on to the questions. First one, what is the difference between entropion and ectropion? So first we should know what is entropion and ectropion. So for that you can just check in the picture, entropion and ectropion of the lower eyelid. See, the first picture represents entropion. Second one is a healthy eye and third one is ectropion. So what difference you can make it from there? Entropion, something which is inward in the eye. Ectropion, outward of the eye. So let's move on to the options. Entropion is the inward, option A. Entropion is the inward turning of the eyelid and ectropion is the outward turning of the eyelid. Yes, that will be the answer, right? Because entropion is the inward turning of eyelid and ectropion is the outward turning. Still, let's check the other options also. Option B, entropion is the incomplete closure of the eyes and ectropion is the drooping of the eyelids. No. Next one, entropion is the outward turning of the eyelid and ectropion is the inward turning of the eyelid. No, it's the opposite. Option D, entropion is the drooping of the eyelid due to nerve disorder and ectropion is the drooping of the eyelid due to muscle disorder. No. So option A will be the answer. Entropion is the inward turning of the eyelid and ectropion is the outward turning of the eyelid. Let's check the answer. Yes, option A is the answer. I'm just putting these pictures so that you can easily get to know what are those medical terminologies. Second question, what type of graft is used when pig skin is applied to a burn wound? Xenograft, allograft, autograft, pinch graft. So first you should know what are these grafts. So just check the picture. The first picture it is showing pinch graft. A pinch of skin is being cut. That is called a pinch graft. Second option, picture represents potential uses for xenotransplantation products. That is xenograft. See, donor is pig kidney for pig skin for burns and the human recipient. So our question is the same, right? Pig skin is applied to a burn wound. So pig skin is applied to a burn wound. That is called as xenograft. Third one, allograft and autograft. See, allograft and what is allograft and autograft? That's also shown in the picture. So our answer here is option A, xenograft, because the question is pig skin is applied to a burn wound. So that will be option A. Let's check the answer. Yes, option A, xenograft. Now third question, ventral, umbilical, spigelian and incisional are types of surgical approaches, hernias, organs found in the digestive system, cardiac catheterizations. Ventral, umbilical, spigelian and incisional are types of, these are hernias, examples for hernias, okay? Ventral hernia, umbilical hernia, spigelian hernia and incisional hernia. So option B will be the answer. Yes, option B, hernias. Next question, fracturing the acetabulum involves what area? So where is this acetabulum located? You have to check that. So options are skull, shoulder, pelvis and leg. So see in the picture, where is this acetabulum socket? It's in the hip joints. Hip joints, just beside the hip joint. So that is the pelvic area, right? So the answer will be option C, pelvis. Next question, when a patient is having a tenotomy performed on the abductor hallucis muscle, where is this muscle located? Foot, upper arm, upper leg, hand. Achilles tenotomy. See the question. See the picture. Tenotomy. Achilles tendon. It's located in the leg, foot side. A small cut is made behind the ankle in the Achilles tendon, repositioning the feet and allowing the infant to turn the ankle upwards. This usually occurs in the, this is an example for club foot, which is usually occurs in the child. Achilles tenotomy is a procedure that involves cutting the Achilles tendon for the treatment of club foot in children. Achilles tenotomy is performed for the treatment of club foot in children. Okay, so here this is performed in the foot. So answer will be option A, foot. Next question, what is the term used for inflammation of bone and bone marrow? Inflammation of bone and bone marrow. Chondromatosis, osteochondritis, and osteomyelitis. See in the picture, inflammation of bone and associated structures typically results from infection, acute up to 1 month, chronic more than 1 month. If it is acute, a small portion of the bone marrow is inflamed, and if it's chronic, that is more than a month, see that inflammation has become bigger. That procedure is called as osteomyelitis. Osteo represents bone, right? So our question is bone and inflammation of bone and bone marrow. So of course the answer will be either osteochondritis or osteomyelitis, because osteo is the one that represents the bone. The question is related to bone and bone marrow. So here inflammation of bone and bone marrow is osteomyelitis. Myelitis represents inflammation. Okay. So answer will be option D, osteomyelitis. Next question. The root word tricho means hair, sebum, eyelid, trachea. Trich is a combining form that refers to hair. Trich. We'll pronounce it as trich. There's a type of specialist called a trichologist who is specialized in the field of trichology, which includes studying and treating diseases and problems related to the hair and scalp. So trichologist is the one who is dealing with the problems related to hair and scalp. So this word represents hair, and that procedure is called trichology. So our answer will be option A, hair. Now complete the series. Frontal lobe, temporal lobe. What is next? So in the picture you can see where is frontal lobe. See, frontal lobe. After that it is temporal lobe. Then comes the occipital lobe. Next is the parietal lobe. 4 lobes of the brain. Frontal lobe, executive functions. It performs executive functions. Temporal lobe represents, it is for hearing, memory and language. This can also be asked as an anatomical question. Which lobe in the brain is used for or it represents hearing, memory and language? Then the answer will be temporal lobe. Occipital lobe is for vision. Third lobe, that is occipital lobe, which is for vision. And last one, parietal lobe, to touch, taste and temperature. Okay, so here the answer will be occipital lobe. Option B, occipital lobe. Next question. A patient is having pyeloplasty performed to treat a uretero-pelvic junction obstruction. What is being performed? So first you should know what do you mean by pyeloplasty. Okay. Option A, surgical repair of the bladder, removal of the kidney, cutting into the ureter, surgical reconstruction of the renal pelvis. So what is pyeloplasty surgery? Pyeloplasty is a surgery done to treat the uretero-pelvic junction, which is also called as short form UPJ, uretero-pelvic junction. Okay, blockage that prevents urine from reaching the bladder. So where is all this located? Ureter, bladder, everything is in the pelvic area. So pyeloplasty is a surgery performed on the pelvic area. So the answer will be option D, surgical reconstruction of the renal pelvis. Next question. Glomerulonephritis is an inflammation affecting which system? This is an easy question, right? Digestive, nervous, urinary, cardiovascular. So where is this glomerulonephritis? Nephritis refers to kidney. It will be in the kidney. Inflammation of the glomeruli and one of the small blood vessels. So kidney. That means this belongs to urinary system. Answer will be option C, urinary. Yes. So these are some of the few questions that had already came for the CPC examination in the previous years. So hope it's useful for you, and let's see you in the next episode. If you like the video, please like and share it, and please subscribe to my channel. Thank you so much, friends. Bye.